Welcome, everybody. As you are aware, we have been experiencing an acute shortage of hospice care in the community that has resulted in longer hospital stays and increased readmission rates to our facility. Based on this need, we have assembled the following team to explore the possibility of starting hospice services as part of DHRA. We have Stephanie Campbell, the nurse manager. We have Christina Morton, who's been working on business. We have Eva Cole, who's been doing marketing. We have myself, Todd Thompson, who's been working on operations. And then we have Deanna Bloss, who's been working on the financial side. To kick the ball rolling, I'm going to ask Christina Morton to talk about business. Christina?
Thank you, Todd. The purpose of our home hospice program is to provide a much needed service to patients in the area where the resources are already very limited. We're going to be providing a family-centered home hospice program for patients who live within a 50-mile radius of DHRA. One of the main advantages to providing this service right now in a limited resource area is that we're going to have great potential for growth in our patient census and a lot of growth in this company. This also means that our marketing department is going to have to step up to the plate and educate the community, families, and patients about what we're here to do and what kind of services we're here to provide. Another advantage of having a hospice program is that we're going to be able to limit the amount of inpatient acute care hospital days that patients are going to need because we're going to be taking care of issues in the home. Another advantage of having a home hospice program is that patients are able to live their final days in the comfort of their own home, in the company of their own family, and not in a hospital setting. Now, this all sounds great. However, implementing the program is going to be quite costly in the beginning. There's going to be a need for our laptops. There's going to be a need to have some kind of security service going to make sure that we provide privacy for all of our patients and their families. And we're also going to need our electronic medical record, which is also going to be very pricey. However, by doing this, we're going to be able to implement the telehospice program, and this is going to leave us with not having to increase our staff necessarily, but being able to increase our patient census. We're going to be able to see more patients in less time. We're going to be saving on gas and just time traveled between patients' visits. The nurses will be prioritizing the patients and who needs to be seen in their home, as opposed to being assessed through the computer. Here again is Todd to tell us about how we're going to implement this program. Thank you.
Thank you, Christine. And just to kind of go over a little bit more about what you were talking, you can see with the numbers that I've provided to the right here that we will be starting with a core hire of an RN program manager, a nurse educator, and a health information technician who will be setting up our home hospice program. And they will actually be working in the field providing the setup for the home hospice program in the field. On top of that, for every 20 to 25 patients that we get, we'll have a care team that will consist of 2 registered nurses, a home health aide, and a social worker case manager. And then every time that we get another 20 to 25 patients, we'll be adding another care team with the goal of having about 4 care teams, or 8 nurses and 4 home health aides and 4 social workers within about the first year. On top of that, we are going to be utilizing hospital support in administration, billing, volunteer services, pharmacy, and things like that. And if you calculate all of that up together, it's going to be about 2.2 full-time equivalents in various different disciplines. Now, if you look at our facility fees, when it comes to implementation costs, we will not have any facility fees because we will be utilizing the home health department facilities. I do believe that as we grow, we will require additional facilities and may have to branch out after a certain amount of time. Also, the use of the DHAR resources when it comes to all of the supporting services are going to keep our costs very low. So when you look at our startup costs, which are the non-salary startup cost, which is what Christine was talking about when it comes to laptop security, electronic health records, professional and non-professional services and supplies, we're going to be looking at about $426,432 plus or minus in that area. So we are working very hard to build a very lean service up front with a lot of growth potential. And now I'm going to turn it over to Deanna, who's going to be talking about income and expenses over time.
Hello, we have heard from Christina who illustrated the advantages of our plan. Then you listened to Todd who spoke about implementation. My name is Diana, I'm the Home Health Chief Financial Officer and I'm here to talk to you about the revenue and the expenses that we are anticipating. Revenue. As far as revenue, hospice is very unique on the way it gets reimbursed. Medicare actually pays a per diem rate regardless of the service rendered, and most insurance pay at least 60 to 85% of the Medicare rate. While calculating the revenue, we were quite conservative with the census projected, even though we know the demand is there, and that is because, as explained by Todd, we want a gradual transition. This will allow for a slow, high-quality workforce development. Also, our team has been working on securing other sources of income. There are a few organizations that offer grants, like CMS offers the Healthcare Innovation Grant. There are a few foundations like the Robert Wood and the Charles Koch Foundations that offer grants, and a few of the major cancer center organizations, which totally makes sense because cancer patients are the biggest utilizers of hospice care according to the National Hospice and Palliative Care Organization. Now, operating expenses. We have calculated our expenses by including the following categories: salaries, benefits, supplies, and both medical and non-medical professional services. Salaries were benchmarked geographically for our Colorado area to make them very competitive. Employee benefits were calculated 24% of each employee's FTE. Supplies, we consider supplies that we use at the office as well as field staff supplies. For medical professionals, basically we count with a pharmacist. We did not venture to the therapy area because under Medicare they can be covered under a different organization and our current market is saturated with therapists. Non-medical professional services, we have considered the following needs: homemaker services, administrative assistants, IT, a volunteer coordinator, and a public relationship staff. Two things about this last category. Number one, hospice is the only healthcare field in which Medicare requires a volunteer force to be present. As a matter of fact, to be specific, Medicare requires that volunteers covers at least 5% of total patient care hours. Therefore, we do need a volunteer coordinator. Number two, we have presented the breakdown of our projected expenses in detail, so please refer to your packages. In the appendix, you could find the budget. In addition to all these numbers and justifications, we are coming to the realization that we have to develop this market for all the reasons mentioned in this presentation. Our market entry is a strategy and internal development of the hospice program. We know that most times internal development will take a little while to break even, but actually we are projecting leaving the red in our balance sheets by the second semester of implementation. Our penetration strategies are simple, but they're pretty robust. For starters, we use very conservative numbers on our revenue calculations, and we count with the DHRA branding. We all know that carries quite a few benefits. Now, let's listen to Stephanie talk about outcomes and benefits.
Hi, my name is Stephanie, and I'm the nurse manager of the home health program at DHRA. I'm here today to talk with you about the expected outcomes and benefits of adding hospice care as part of our home care services. Part of DHRA's mission is to be the regional leader in patient care. Adding the much needed hospice care to our currently provided services gets us a step closer to fulfilling this mission. The addition of hospice services will provide our community with a service that currently does not have enough providers to meet their need. Hospice services will decrease the number of palliative care patients who are being readmitted to the hospital post-discharge. It helps to put our families and our patients first, provides quality care, and provides our palliative care patients with respect and the dignity they deserve to be able to pass in the comfort of their home. The addition of hospice also helps home care to be financially sustainable, increasing our revenue in the coming year. Our current home care staff is excited about this opportunity to continue to enhance the lives of our patients and to provide a much needed service in our ever-growing community. You've heard from the team all the great things we can do with hospice care. Now Eva is going to join us to talk with you about our marketing brochure and how that can help benefit the growth of our business, as well as provide our patients with much needed education on hospice care services. We can't wait to get this part of the program up and running, and we hope to have your continued support of hospice care. Thanks.
Thank you for that great introduction, Stephanie. Hello, my name is Eva, and I'm the new Director of Marketing. I'm honored to be here today presenting the marketing plans for this innovative hospice program. We've determined that our target audience would include terminally ill patients and their family members, along with the referring community providers and DRHA social service professionals. The next step in our marketing plan involves creating marketing material. We all agreed that brochures would be the most effective way to promote this expansion of DRHA services. Brochures were created to encompass both customers and referring providers. So this is the patient brochure. Our consumer brochures will not only educate patients and their loved ones about hospice, but also identify reasons to select our hospice program over competitors. The first panel simply states quality end-of-life care in the comfort of your own home. The remaining sections detail our program's goals, which correspond to DRHA values, and lists the many disciplines that will be involved in their hospice care. So this will be the inside of our patient brochures. It contains information to educate consumers on fundamentals of hospice care and qualifying for these services. Additionally, the brochures present a family member's hospice testimonial and features that set our program apart from other hospice programs. We elaborated on the telehospice component of our program, which is a feature that no other hospice programs in this state offer. This is the second brochure we created. It focuses on increasing patient census by generating referrals. These brochures have information to educate providers about hospice care facts, eligibility, appropriate candidates, benefits of early referrals, and unique features separating our hospice program from others. The focus of this information is not only to educate providers, but also to enlighten them about the steps we've taken to make the referral process and transition simple. This is the inside of our provider brochure. It stresses the importance of hospice for patients while detailing the importance of program highlights. Within the first quarter, our nurse educator will visit DRHA and other referring providers to distribute these brochures. We will give them a few referring provider brochures and plenty of patient brochures to hand out. During monthly visits that will be made to these areas, we will continue to encourage referrals and spread the word about our program. We will use volunteers to distribute the remaining patient brochures to any appropriate local healthcare facility waiting rooms, support groups, and community resources. The other local hospice program would also be offered these brochures since they are unable to provide adequate care for the high volume of patients referred. Thank you all for taking the time to learn a little bit more about this innovative program.